Welcome to our presentation on the administration of drugs. This presentation will talk about the drug administration, the different routes of drug administration, the factors governing the route of drug administration, the local routes of drug administration, and the systemic routes of drug administration, its disadvantages and advantages. So how do we define drug administration? So when we say drug administration, that is defined by the MSD manual as the giving of a drug by one of the several means or routes. So drugs are introduced into the body by several routes. They may be taken by the mouth, that is orally, given by injection into a vein, intravenously or IV, into a muscle, intramuscularly or IM, into the space around the spinal cord, intrathecally. It can also be beneath the skin, subcutaneously or SC. The drugs can also be placed under the tongue, sublingually, or between the gums and the cheek, buccally. The drugs can also be placed or inserted in the rectum, so rectally, or the vagina, through the vaginal route. It can also be placed in the eye by the ocular route or in the ear, by the otic route. The drugs can also be sprayed into the nose and absorbed through the nasal membranes, so that's the nasal administration, or it can also be breathed into the lungs, usually through the mouth by inhalation, or by mouth and nose by nebulization. So drugs can also be applied to the skin or cutaneously to produce local, topical, or body-wide systemic effects. It can also be delivered through the skin by a patch, transdermally, for a systemic effect. So each route has specific purposes and also has advantages and disadvantages. So the next slide will enumerate the factors governing the choice of route of drug administration. So for a drug to act and produce its characteristic systemic effects, it must first be absorbed and then attain an effective concentration at its site of action. Most drugs can be administered in a variety of routes, and the choice of appropriate route depends both on the drug as well as the patient-related factors. So these are the factors. So we'll start with the physicochemical properties of the drug. So for example, some drugs are lipid soluble and the others are not. So some drugs are acidic and the others are basic. So this will influence the choice of the route of the drug administration. We also have the site of the desired action, whether the desired action is localized or generalized. The rate and extent of drug absorption from different routes. We also have the effect of the digestive juices, the ruminal microflora, and the first pass metabolism on the drug. We also have the intensity of the action desired, the type of response desired. So this is important. For example, in emergency cases, the response that is desired is immediate. We also have the accuracy of the dosage required. So there are certain diseases or certain cases that needs the accuracy of the dosage to be administered. We also have the condition of the patient, whether the patient is unconscious and whether the patient is vomiting. So it will influence the choice of the route of drug administration, and these factors will be later explained deeper in the succeeding slides. So the slides to follow will enumerate and classify the different routes of drug administration. So the routes of drug administration can be generally classified into the local and the systemic. For the local route, this can also be used for localized lesions at accessible sites. In terms of the systemic absorption, of course, for the local route, the systemic absorption is absent or it can be also minimal. And of course, in terms of the systemic effects or toxicity, it will also be minimal or absent. Under this, now we have the topical drug application. So the commonly used local routes include the topical application. When we say topical application, that refers to external application of the drug to the surface for localized action. So in the topical application, the drugs can be applied or administered by the skin or the mucous membranes. So for the skin, the drug is applied as an ointment, lotion, liniment, powder, and others. For the mucous membranes, the drug can be applied via in order to clean or wash the buccal mucosa. The drug can also be applied as an ointment or drops in the mucous membranes of the eye, the ear, and the nose. There are also non-absorbable drugs like the aluminum hydroxide, kaolin, neomycin, and others, which is administered orally to act in the mucous membranes of the gastrointestinal tract. We also have the suppositories. So the suppositories can be inserted in the rectum or in the vagina to act on these mucous membranes. We also have the placement of drugs in the mammary gland. So that is the intramammary infusion of the drug, and the uterus or the intrauterine drug administration. So all of these are examples of the drug application in the mucous membrane, and these are classified under the topical drug application. The next classification is the systemic route of drug administration. So the systemic route of drug administration is intended to be absorbed into the blood and distributed all over the body. The different systemic routes of drug administration may be of two broad categories. We have the oral and the parenteral routes. So we'll start with the oral administration. So the oral administration is also termed as the enteral route of drug administration. The word enteral now comes from the word enteron, meaning the GI tract. So it is one of the commonest, safer, non-invasive, and painless methods of drug administration. So it is considered to be also cheaper because the drug is not required to be sterile. So there are a variety of dosage forms that are available for oral administration. We have the solid. The drugs can be in the form of a solid, liquid, as well as sustained release products. The oral administration is also called as PO or per os dosing. Per os is a Latin phrase which means through the mouth or by mouth. So most drugs are better absorbed orally on an empty stomach. And the principal site for the drug absorption for those drugs that are given orally is the small intestine, because the small intestine has an extensive area and rich blood supply. The diagram shows the oral administration of a drug, albendazole, in mice. These are the factors affecting the absorption of orally administered drugs. First, we have the presence of food. So the drugs can form a complex with the ingesta or the nutrient, and this can retard the drug absorption. We also have the pH of the environment. So the pH of the environment, whether it is acidic or basic, can influence the drug absorption. We also have the property of the drug, which is the pKa, and this can also affect the drug absorption. And this will be explained in detail in the section on pharmacokinetics of the drug. We also have the effect of the gut microflora. So the gut microflora can induce the degradation of the drug, and this is particularly important for ruminants. We also have the rate of the gastric emptying. So a faster gastric emptying can also limit the drug absorption. We also have the changes in the intestinal blood flow. So those segments of the intestines with greater blood flow also has greater drug absorption. Degradation of the liver or the first pass effect can of course greatly influence the amount of the drug that reaches the systemic circulation. These are the limitations of the oral route of drug administration. First, the action of the orally administered drug tends to be slower, and thus it is not suitable for emergency cases. Second, some drugs can cause nausea and vomiting. Certain drugs that are administered orally are also not absorbed because they are highly ionized. Some drugs such as penicillin and insulin can also be destroyed by digestive juices. Hence, their action will not be attained. Or testosterone, for example, can also be destroyed in the liver. Absorption from the GIT is also slow, irregular or erratic and uncertain, and this is true in the case, for example, in ruminants. So another limitations of the oral administration in the case of ruminants, the rumen fermentative activities in the microbial population pose hazards for the chemical stability of certain drugs. Example of this is the drug chloramphenicol as well as the digitalis glycosides. So in adult ruminants, the administration of chloramphenicol is not recommended because the drug is metabolized by the rumen microfauna more rapidly than it is absorbed. Another is the oral therapy with antimicrobials suppresses the beneficial effects of the ruminal and the intestinal microflora. So as we all know, the certain B vitamins are synthesized by the rumen microflora. And when the antimicrobials are given, so these antimicrobials, when given orally, they can induce the suppression of the beneficial effects of these rumen microflora. Hence, leading to the inhibition of the B vitamin synthesis as well as the incidence of superinfection. So when we say superinfection, that is an additional infection that happens during or immediately after an infection. And this can be induced by the oral therapy with antimicrobials. The next is the parenteral route of drug administration. So when we say parenteral, that is beyond enteron or GIT or away from the GIT. This refers to the administration of drugs mainly by injections, which take the drug directly into the blood or tissue fluid without having to cross the intestinal mucosa. These are the advantages of the parenteral routes of drug administration. So in a parenteral route of drug administration, the drugs are absorbed more rapidly. Next, the effective dose can also be selected more accurately. So when we say effective dose, that is the dose of the drug that will achieve the desired effect. So in the parenteral route of drug administration, when we are going to compare it with the oral route of drug administration, so the effective dose can be accurately selected when the drug is given parenterally. The action is also relatively faster, and the interference by food and elementary juices and the first pass metabolism are avoided, and therefore drug is absorbed in the active form. So what is this first pass metabolism? So when we say first pass metabolism, that is a phenomenon that is also known as the first pass effect. That is a phenomenon in which a drug gets metabolized at a specific location in the body that results in a reduced concentration of the active drug upon reaching its site of action or systemic circulation. So where does this first pass effect happens? So of course, these are true for those drugs that are given orally, because these are associated with the liver. The liver is considered to be the major site of drug metabolism. The other sites of the first pass effect occur in the lungs, the vasculature, the GIT, and other metabolically active tissues in the body. So this first pass metabolism, as well as the presence of the food, as well as the alimentary juices, the gastric juices, can be avoided in the parenteral route of drug administration. For the parenteral route of drug administration, the economy of the dose is ensured. It is also preferable if the patient is unconscious or uncooperative or already vomiting. Gastric irritation and vomition are not provoked in parenteral routes. These are the disadvantages of the parenteral route of drug administration. First, it requires strict asepsis and sterile conditions should be maintained, and therefore it is expensive. Second, it is relatively risky and there are chances of local tissue injury from injection sites. Third, it is also an invasive procedure and it is painful from the injections. The parenteral routes include injections, inhalations, transmucosal, and transcutaneous drug administration. Administration by injection includes the following routes. First, we have the drugs can be administered beneath or under the skin, so that is known as the subcutaneous or SC drug administration. We also have the drugs can also be administered in the muscle, intramuscular IM, in a vein, intravenous or IV, and intrathecal around the spinal cord, intraperitoneal, meaning within or through the abdomen. So let's start with the IV or the intravenous injections. So in the IV injections, the drug is injected as a bolus. So when we say bolus, that is a single dose of the drug or a substance now given over a short period of time. Or it can also be infused slowly over hours in one of the superficial veins. The drug directly reaches the bloodstream and effects are produced immediately. So this is the route of choice for emergency cases. So for the advantages of the IV injections, even highly irritant drugs and hypertonic solutions can be given by the IV route. The dose of the drug required is smallest, and even large volume can be infused via this route. So in the IV injections, the bioavailability is considered to be 100%. When we say bioavailability, that is the fraction of the administered drug that reaches the systemic circulation. So only aqueous solution can be injected IV and not suspension or in oily vehicle. The IV route is considered to be the most dangerous route of drug administration because the vital organs such as the heart and the brain gets exposed to the drug in high concentrations. There is also a risk for the development of thrombophlebitis. So when we say thrombophlebitis, that is the swelling or inflammation of the vein. There can also be necrosis of the adjoining tissues. There can also be the development of thrombosis or embolism that can affect the blood circulation, particularly the transport of oxygen in the bloodstream. For the case of horse, cattle, and sheep and goats, the common site for the IV injection is the jugular vein. This diagram shows the IV injection site in cattle, which is the jugular groove. For dogs and cats, the most frequently used sites for IV injections in the dog are the cephalic and the lateral saphenous veins. Cats are most often given IV injections in the cephalic, medial saphenous, and the femoral veins. For pigs, there are 3 sites for injecting medicines directly into the bloodstream. So we have the ear veins, the jugular vein, and the anterior vena cava, or the large vein. The ear vein is the most common method, particularly for anesthetics and occasionally calcium injections. This diagram shows the ear vein, and the ear vein can be used for the intravenous injection. It is less useful for blood sampling because it readily collapses when negative pressure is applied. The diagram shows the blood collection from the cranial vena cava in a standing pig. So in this case, the needle is inserted at the caudal extent of the jugular furrow, the right jugular furrow, lateral to the manubrium. Let's now proceed to the intramuscular route of drug administration. So the IM injections are preferred to the SC route when larger volumes of drug products are needed. How quickly the drug is absorbed into the bloodstream depends in part on blood supply to the muscle. The sparser the blood supply, the longer it takes for the drug to be absorbed. The IM route is used when the effects are desired over a longer period than can be expected after an IV injection. For drugs that are too irritant to be given via the SC route, or for oily solutions which cannot be given IV. Peak plasma concentrations occurs within 30 minutes. These are some of the advantages of the IM route of drug administration. First, absorption is more rapid as compared to the oral route. This route can cause less pain than the IV route. And mild irritants, depot injections, soluble substances, and suspensions can be given by this route. So the IM route now is also convenient in administering drugs in animals that are difficult to restrain. It is also used in administering aqueous or oleaginous suspensions or solutions. So when we say oleaginous, that has the nature, the qualities of oil, and muscles are considered to be highly vascularized. Thus, drug could be absorbed hematogenously or through the lymphatic fluid. For the disadvantages of the IM injections, IM injection into fascia might lead to erratic absorption of the drug. There is also a possibility of improper deposition of the drug preparation in the nerves, fats, blood vessels, or between muscle bundles in connective sheaths. Aseptic conditions are also needed in the IM injections. This is an adapted slide showing the factors to consider in IM injections in dogs. So for IM injections, in general, so the needle that is needed is a 21 to 23 gauge needle, and the length is about 1 to 1.5 inches long. So the intramuscular tissue is considered to be richly supplied with blood vessels, so that medication is more rapidly absorbed by this route as compared to that of the SC route, of drug administration. Because there are fewer pain receptors in muscle tissue, consider this site for more irritating or viscous solutions or medications. This will reduce the possibility of tissue damage. So this is one of the advantages of the IM route of drug administration. Intramuscular injections may be performed in the thigh muscles of the front or the rear limb, now using the hamstring muscles on the back side of the rear leg, and this is true for dogs. We also have here the placement of the intramuscular injection to the quadriceps. So avoid hitting the sciatic nerve. So when injecting into the muscle, be sure to direct the needle away from the sciatic nerve that is located medially on the leg. Let's now proceed to the subcutaneous or the SC injections. So the drug is deposited in the loose connective tissue, which is richly supplied by sensory nerves, so that irritant drugs cannot be injected via the SC route. The area is less vascular compared to that of the muscle, so that the absorption tends to be slower. So this diagram shows the schematic diagram of the skin, the subcutaneous tissue in the muscle, and showing also the injection site for the SC route of administration, as well as the angle of the injection at 30 to 45 degrees. The SC route should be avoided in patients with cardiovascular shock, because during the cardiovascular shock there is vasoconstriction, which can lead to the delayed absorption of the drugs. These are the factors to consider in subcutaneous injections in dogs. So an 18 or 20 gauge needle can be used with a length of 1.1 to 1.5 inches. The subcutaneous medications are deposited into the loose connective tissue just below the dermis. This tissue is not richly supplied with blood vessels as compared to that of the muscles, so the absorption rate is lower. There are many pain receptors in this tissue, so that only non-irritating water-soluble medications in small doses should be given by the subcutaneous route. This diagram shows the placement of the needle for the subcutaneous injection in dogs. So the loose, the loose skin over the shoulders and the neck is an ideal site for the subcutaneous injection. This diagram shows the subcutaneous SC injection sites in cattle. So the arrows point to the approximate locations of the injection sites in the neck and the ribs. This is taken from the University of Bristol. This diagram shows the preferred site for the intramuscular and the subcutaneous sites for cattle. We also have here areas that must be avoided when doing the IM or the SC route of drug administration. For all cattle, and especially beef cattle, the preferred site to give intramuscular injections is into the neck muscles to avoid damage to higher price cuts of meat or the risk of damaging the sciatic nerve, particularly for thinner cattle. This diagram shows the preferred injection sites and ship from the University of Bristol. So for the SC route of administration, so for a ship that is behind the shoulder and over the ribs. For the intramuscular or IM injection, so this is the preferred site, the neck area, as well as in the quadriceps, cranial to the femur to avoid the sciatic nerve. We also have the intravenous site that is through the jugular vein.